Hello. Yes, awesome. Well, I'm recording with my computer today, so we'll see. I'll be speaking louder definitely once we start. We started the recording already, and I'm just getting ready. Here. This looks and ready recording. Let's see. Okay. Good to go. Okay. Let's put this around. Guys, you can still hear me well at home? Yes, awesome, 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 great. So here we go. Well, first of all, definitely all of you most probably got my email. It has all of the exams for the rest of the year, right? Or for the rest of the semester. So hopefully we'll stay on schedule. That's my that's what I want to do. Hopefully we'll stay on the schedule, get exactly the same amount of lectures that we want on the specific days, so we have the exams on the specific dates. But yeah, it has the lectures and it has the exams for all of the materials that I'm teaching, and it has also some of the labs again, as I said. Okay, so next week we have exam for materials, right, on Tuesday, and then for science on Thursday. So we'll try to keep that. We have one more lecture for materials, and we'll be done. It'll be a small lecture, and this is the lecture before that. In this lecture, it actually has two chapters. It has abrasion, finishing, and polishing, and that's a chapter by itself. And it also has the reminder of the of chapter 16. Chapter 16 was about gypsum and waxes, but we didn't talk about waxes then. So it has the waxes part of chapter 16. Anyway, they're both in this presentation for today. And I think it's also like it's not a heavy lecture today. We'll just talk generally about, at least in the first slides, about the abrasion and finishing and polishing. Technically, these are the things that we do for our work. So when we do a filling, how we finish it, how we polish it, what are the general materials that we use in dentistry to do that, what are their properties, and we get to know a few things that we use and do. And then with waxes, what are the waxes that we use in dentistry and what do we use them for? So again, I don't think it will be that much of a heavy lecture. And let's go start with it. Okay, so we have the definitions first, definitely. What is the difference between polishing and finishing? So one of them is the procedure to remove or to reduce excess restorative materials. Huh? You don't have access to it? It's on Canvas. It's chapter 13 and 16. It's in materials. Oh, is this 12? 12 and 16. So we have two, again, the definitions for these. So which one is polishing, which one is finishing? So we have procedure to reduce excess restorative material, and the other one is procedure to produce shiny and smooth surfaces. So one of them is polishing, one of them is finishing. Which one do you think, guys, is the one to reduce the excess material? Finishing, actually. And then polishing is the one that would produce a shiny and smooth surface by eliminating fine scratches and minor surfaces imperfections. So that's usually what we do after we do a filling. For example, composite, that's most of the fillings that we do. We do a finishing touches for it at the beginning with a specific burrs that we use. And then, just to restore the anatomy of the tooth, the cusps, the pits, the fissures, or generally the fissures, not the pits, but the anatomy, the contours of the arches or of the teeth, of the surfaces of the teeth. And then we're going to do a polishing to make it look nice and shiny and more natural as possible. Okay, we're good with that, finishing and polishing. So some factors to think about that will determine the rate of abrasion. Definitely the materials, most of the materials that we use for abrasion would have some particles in it, right? That we can use to actually either finish or polish. So the size of the particles would be a determining factor. Right? How much irregular they are. The more irregular, the more that they would cut. Usually, the bigger the size, the bigger that they will cut. The smaller, the finer, and the more polish that we get. How hard they are, definitely the harder, the more that they cut, right, or abrade. How much particles in each surface, in the contacting surface. So again, well, the more that you have it, the smoother that it will be. And then the pressure and speed. And this is what also we talked about when we were doing coronal polishing. When we talked about coronal polishing, we said we don't want to apply a lot of pressure because the more pressure you apply, the more that you're going to hurt the tooth. Although, it also relates to creating of the heat when you apply the pressure. The more speed, definitely, the more that you hurt the teeth, and so on and so forth. So a lot of common sense, just general things about how the rate of the abrasion is determined. Moving on, technically, I'm kind of on the same thing. So, um, blank is the ability of material to resist abrasion. I think we took that before in one of our slides before, and that is hardness. Hardness is the ability of the material to resist abrasion. And again, this is what technically we talked about already, the rate of abrasion. So we said the pressure, we said the speed. And also we have to take in consideration the material that is being abraded, not only the materials we use to do the abrasion, not, for example, the prophy paste that we're using, but also, are we polishing the tooth? Are we polishing composite, or are we polishing amalgam? So that makes also a difference. So particles that are large and irregular will cut more or less efficiently. More, right? They'll cut more efficiently. The bigger they are, the more irregular they are, they will cut more efficiently. Have you seen these burrs before? These are burrs, by the way, the burrs that we use in our high-speed handpieces that we use to cut. Well, it can be also in some of the low speed, but specifically these, the shape of them, you can see how they are really grainy. These are called diamond burrs, right? So diamond is the most used material or the most used abrasive in dentistry because we use it to cut enamel. And enamel is the strongest material in the body, and that's why we need really strong type of burrs to be able to cut through it. So these are diamond burrs. You're going to get to know more about the burrs. I think with Ms. Jukes, she'll talk to you about the types of burrs and the use of them. But generally, diamond is an abrasive that we use on these burrs to actually make them cut through the enamel. and it's the most abrasive material used in the industry. Speed and pressure, we already talked about that. Increase in pressure will increase in the deeper scratches, right? You might actually also produce less control amount of material being removed. So you have to apply, good amount of pressure when you're working. And again, we kind of talked about that in coronal polishing. So you don't want to press too much. You have to know, to measure your press depending on for example, again, for crown polishing, depending on how much stains they are and what is the material that you're using, does it have coarse abrasors or fine ones, and so on and so forth. Also, with having speed and pressure, it can produce what? Heat, right? And we call that frictional heat. So technically, because of the friction, can produce frictional heat. And the teeth are living things, living parts of our body. It has the pulp in them. It has the nerves and the blood supply. And if we're producing too much heat, it might actually hurt the tooth or even kill the nerve inside of the tooth. So it's important not to overheat the tooth. And that's why you see in our handpieces, the high-speed handpieces, they have water with them, right? When you do cut the tooth, they have water. And the water is to cool down the tooth because of the too much frictional heat that can happen with using the diamond burrs on the enamel, okay? Again, a lot of these things are kind of common sense and not a lot of deep information. So we're just, again, getting to know the materials that we're using. So we have different types or different systems to deliver these abrasives. How can we use these abrasives in the mouth, right? So we have bonded, loose, and coated abrasives. So blank abrasives are powders, pastes, classified by their grit and particle size. Powders, you think they're bonded, loose, or coated? Loose, right? They're loose abrasives. So, they're just powders. They're loose. They're not bonded to anything. Blank abrasives, these are some rotary discs and handheld finishing strips. These are the coated ones. Have you seen sand discs, right? Or sandpaper? It's just the paper that has some grits on it. We technically use that in dentistry as well. We usually use them in a form of discs. So you can see these discs that we have here, and we put them on a specific burr that we can replace the discs that we have. And these, again, come in different grits. So it can be coarse, or it can be fine, or it can be medium, and it's used to do different types of finishing and polishing for us. So that's another type of, and this is the loose abrasive technically, the prophy paste that we already used. And then you have the last one, which is the bonded abrasives. And these have already, put in together and bond together the abrasive particles inside of the whatever we're using, if it was a burr or a disc, to be able to shape and polish the teeth. Again, just regular information about how can we apply these, or what are the delivery systems, how can we use them inside patient mouth. It can be loose, it can be coated, and it can be bonded. An example of loose are powder and paste. An example of coated are rotary discs or sand discs. And let's see, did we get an example of that? Not really specifically, but again, I can ask you, like, what are powders and pastes are example of what type of delivery system, right? Or rotary discs are what type of delivery system for abrasives. Okay. Materials used in abrasion. We have 2 slides of these. I kind of want you to know a few of them. I put a different color for them. So diamond, as we said, diamonds are really used a lot in dentistry. And just to know, at least if I ask you, for example, lists 5 or 4 of the abrasive materials used in dentistry, right? At least you know some of them. So for example, again, diamond here, You have carbide finishing. The carbides are the one that has blades in them. You can see they have like blades in them. These are called carbide. Silicon carbide, we have a different type of carbide that is silicon. We have sand, like the sand discs that we already talked about. Silicon oxide that can be used in prophy paste. This one is a little bit more coarse one. So if you have heavy staining, we usually use that in there. We have pumice, and pumice is used a lot to do the cleaning when we want to do sealants, and also they use it in the laboratory part. It's like a powder. Aluminum oxide and other ones, tin oxide also used in prophy paste, and calcium carbonate also used in prophy paste. So again, just know these few things that I colored just to get a general idea about what are the abrasive materials that we use in dentistry. I think this is pumice, if I'm not wrong. I think it, because this is exactly how it looked like, but I just don't want to say in case this is something different. Maybe I think tin oxide sometimes it comes in that as well. Usually it comes with a. They even mentioned that it comes with water, the tin oxide. But if I'm not wrong, this is most probably pumice. We do have it in the lab as well. Yeah. And yeah, I mean, if I get you a picture of that, you know these are discs, right? If I get you a picture of that, you know these are prophy paste. We already know that. And you know these are diamond burrs. Okay. This thing is keep moving with me. Okay. All good. Again, a lot of just general information. So now we're going to talk a little bit about amalgam polishing because it has specific thing to it. So you do not want to polish sooner than 24 hours after insertion, after you put the amalgam in. It needs to be completely set and completely hardened before you polish it. Again, amalgam is not used that much often nowadays, but it's an information to know because we do polish fillings. For example, composite, we polish it right away. You put the composite in, you finish it and polish it in the same session. Amalgam, if we place it in, we can just finish it with our hand instruments, but we're not going to polish it until about 24 hours, so to get it to completely sit and settle in the mouth. Not really financial, no. Sometimes the well, if the filling, if the cavity is too big, sometimes that's one of the main things. Sometimes dentists would prefer that if the dentist did not want to, if the patient does not want to do a crown. I mean, that can relate to financial maybe because crowns are much more expensive. So sometimes some dentists would do amalgam because it's too big of a filling, and you know they like amalgam. So some dentists really prefer amalgam. They have a good experience with it. It's a good material that can last long and can, you know, stay in big fillings. But nowadays, again, we have composites that can do that as well. So a lot of times it's like multi-factors and more about the dentist choice. You know, they like amalgam and they worked with it for a long time. And yeah, amalgam. Yeah, definitely. They just there is a removal process. Remember, I showed you one time. You know, they can remove it and they replace it with composite. And then sometimes they do that. Usually, if it's not broken, don't touch it. You know, don't. What is that word? If it's not broken, don't fix it. Right. So if it's not broken, don't fix it. But you know, after about 15 years of amalgam, it goes. You know, it kind of disintegrates from the margins. You'll see like just kind of shrinks a little bit on itself. It's not a shrinkage, but it's not. It's cutting through the margins, so it's not more. The marginal integrity is not good anymore. So they would remove it and they would just place composite to it. But usually we don't replace it just because, you know, just because of the color, unless the patient wants to. Yeah, we advise them not to because you know you have to cut it and do that. But sometimes if it's, you know, showing, when they're smiling or talking, or sometimes, you know, they are irritated by it, then we do it. Yeah, we can be. And amalgam, if it's polished, it can be really nice. It can be really nice, like silver color. We have a video to see maybe if we have some time about amalgam polishing. And you can see we can actually polish it more than one time. So it might benefit from periodic polishing because it would reduce the corrosion that can happen and the creep that can happen to amalgam. Usually we polish it with these type of burrs. We call them greeny and brownie. Yeah, brownie and greeny. And, you know, we have points. Again, I don't want to go too further in burrs because I think Ms. Jukes is going to show that to you. But generally, this shape are called points, and this shape is called, so this is points, and this is a rubber cup, and this is like a disc or a wheel. But anyway, yeah, these are. Which ones? Yeah, so they are. Well, I think the greeny are more stony, like stone-like type, and the other one is a little bit less than that. But they're some of them are a little bit more coated with rubber, but these specific one, I think the greeny ones and the greeny and brownie ones are a little bit less rubber and more stony, like a stone. Yeah, but we do have rubber ones that we use for regular polishing. Yeah. And they usually also, again, it's like integrated with other things in it. So it might feel a little bit rubbery, but it's more coarse than the regular, just rubber, completely rubber burrs. Yeah. For composite, you just you can do it right away. You can do the polishing right away. And a lot of times it's like a complete system. So they'll give you a system. Well, use this burr first, and then use this burr first, and next, and then you use this type of paste with it. So I didn't want to go too deep because it's just there are too many systems out there, and each dentist would prefer a specific thing. But generally, we want to get the marginal and occlusal removed. You know, the excesses removed, and then we can use discs and strips. These are the strips that we're talking about. These just like a long line of clear uh, tape in a way that has sandpaper on both ends. One is more harsh than the other. You know, one is for finishing, one is for polishing, depending on the system that you're using. But anyway, and then you can use polishing paste with rubber cups or pans. So see, this is a cup, this is a disc, this is a point. Anyway, um, as I said, you know, you don't have to wait for composite. Amalgam, you have to wait 24 hours. Composite, you can do it right away. You remove the excess and then you clean it up a little bit and then you can polish it. For gold, although most probably you're not going to see it much anymore, but we use Burlow wheels. These are specific ones for gold, and we use them with slow speed. Well, most of the polishing and finishing is done with slow speed hand pieces, but again, for gold specifically, we use Burlow wheels, and these are Burlow wheels. Coronal polishing. So it is mixture of abrasive. It can be tin oxide, pumice, lubricant, and as we saw in the other slides as well, aluminum oxide, I think it has, calcium as well. So it has different types of abrasives. It comes in a coarse and medium and fine ones. And again, nowadays we don't want to overdo the coronal polishing. So you can see there's no scientific proof shows how much enamel is removed during the polishing. So when we do the polishing, although our goal is to remove the biofilm and the plaque from the tooth surface, but a lot of times we end up also removing some enamel. So if we're doing it too strong with a lot of pressure or too fast or with the wrong type of grit, like we're using too much coarse grit, we can actually damage the tooth. We can remove some enamel. And that's why we should not do it, you know, more than twice a year, right? We have every 6 months we can do some kind of polishing, coronal polishing. But at the same time, nowadays, we have more of an idea of selective polishing. So we should look at the teeth and um, what is the word? So we look at the teeth and then see which part of them needs to be cleaned more, which surfaces have more staining, for example. So on the surfaces that has more staining, you can use more coarse grits with your chrome polishing. With the surfaces that do not have staining, you just do a regular polishing with an extra fine or fine a grit type, just like almost like a toothpaste. So it should be selected or selective polishing, but I can tell you nobody does that, most probably. No one is going to look in your mouth and, oh, you have a filling here, you have a composite, you have a crown there, and do selective polishing. I don't think so, honestly. They'll just go in and clean it up. Most probably they have one type of prophy paste that they use for all patients. But again, I mean, it's a good idea to, I don't know, but I don't think there's many people that use different type of grits. But it is always advised to use the minimum coarse, material, so the finest material, so that you do not harm the teeth. And again, if you see that this patient needs a little bit more, they have areas that they have more staining on, then maybe you can use a coarser type of tooth prophy paste. Okay, let's stop here for a second. Let's watch a few videos about polishing composite and amalgam. So let's go there. This. These videos are also again in the resources for the exam. So we have all of these for abrasives and waxes. Well, I don't have for waxes, but these are mainly for abrasives. So if we look at this video here, I guess I need to share my screen there. Let's see. Okay. So this is composites polishing. So let's move on to here. You can see now it doesn't look like a tooth at all, right? It's just like a shape of a tooth. And they're going to start using different types of discs and materials. See, this one is a medium flexi disc. So you can see it flexible when you use it. It kind of bends. So these are, a lot of dentists love these because they bend with the contour of the tooth. And they're really easy to use. And they have, again, different types of grit sizes. So this one is medium. Then you see, if we go, this is the main anatomy. This is the secondary. Now they're using a high speed with a really fine, I think it looks like it's a fine diamond burr to create some of these few ridges that we can see on our central incisors. Yeah, well, this is a filling, for example. Yeah, like this is a complete filling of the labial surface. And this is just kind of an educational video about what you can use for dentists, what they can use to polish the composite in the good way. Yeah, so they're just, showing multiple different burrs and materials that you can use to make your composite look nicer. So far, they used, 4 types of burrs. Now, this is the pointy one. You can see it's blue. This is the final polish. So it's like a system. As I said, sometimes it comes in a kit where you just do 1, 2, 3, 4, and you're done with it. But it's also an art, so people really sometimes have a nice time doing all of that. See, this is a fine disc. There at the beginning, they used a medium one. And they keep polishing out. This one is even super fine, if I'm not wrong. Let's take a look. See, this is the super fine disc. And you can see now the luster, it's coming up, right? It's really looking nice. Are they using a pointed burr or disc? And now they're using a paste, specifically for composite, to polish composite. Another disc, that's like a puff disc. And you can see it's really, really looking nice. I think they're just going to wash it, and then it will really show how much difference, it looked before and after. But you can see how many types of burrs that they use. So there's like an infinite number of types of products that you can use to really do your polishing. Just depends on the case and the preference of the dentist. Looks really nice, almost like real, huh? We started with what? We started with this, and now the end product is that nice too. So yeah, I mean, polishing can make a big, big difference in the filling, especially for interior teeth, to make them look more natural. And this is for amalgam, just again to see, will definitely produce more smoother, get less retention for the biofilm, resist tarnish and corrosion, and increase the longevity. These are the burrs that they're using. I just want you to see, like at the beginning, see how it starts with amalgam that looks really not nice or not well finished. And they just keep going at it with different types of burrs that they have. Again, it's a system. Changing burrs. This is a slow speed handpiece, and this is a brownie. You see, they started with a greenie, and now they're ending with a brownie. And this is a disc. I mean, a cup, a brownie cup. Going back to the greenie here, greenie cup. I just clean it up, and you can see how shiny and nice looking it is. And as we said, for amalgam, we want to wait for 24 hours before we start polishing it. Okay. So there is a different type of polishing that we use, which is called air polish. Have you heard about that? Have you seen this before? No. So technically, air polish is it's a device that connects to the handpiece connection, and we put some silica powder, aluminum powder in it, again with different types of grit. It's like sandblasting, right? Sandblasting, have you heard about that? They put some sand and water with a lot of pressure and air, and they can clean up a lot of things. So air polishers are coming more, popular, but they're also, again, you have to use them responsibly because you can hurt the teeth, but they're really nice and they can remove stubborn stains on the teeth. So let's take a look at this. Oh, we don't have sound because. But yeah, see, this is the device. This is where you put your powder in, and it connects to the handpiece, like a high-speed handpiece, something like that, similar to it. You definitely need high volume evacuation as you do the work. And you can see they're working on the cervical areas here. Again, this can be hurtful to the teeth if you don't do it right, but it's a lot of strong water and again, powder, depending on the powder that you're using, and it really produces a good, nice finish for the teeth. It removes a lot of the stains. Okay. We're going back to the slides. So full screen. And this is the air polishing we're talking about. So it uses powder, flavoring agents, definitely air and water at a lot of pressure. So it's fast and effective. removing a lot of stains and soft deposits. Some powders that we use, sodium bicarbonate, aluminum, and then all of these kind of things. You don't have to memorize these, but it uses powder. Um, and again, this is the device that we just looked at. The picture, you put the powder in here, and you can use it. And there are different systems out there um, to use that, but it's a good choice as well. Air polish. No, the slide name there. Okay. For lab as well, definitely we use some polishing materials. One of the main thing that they use is the rag wheel, which you see here. Technically, it's cloth sewn together in the shape of a wheel. So it can be in a big machine, like the machine that you see here, or it can be handheld with a handpiece. So it can be handpiece, or it can be used with a lathe machine. And they use a lot. They use it a lot to completely to polish the complete and partial dentures and the crowns. And again, they do a lot of polishing in the lab for all kind of different things. But this is you'll see that even in our lab, we use it to polish our work next semester. This is the lathe machine that you see here. And this is the rag wheel into it. And we actually have this in the lab. Well, we don't have it in the lab. We take it in and out. And then you have also a lab handpiece. I feel I'm forgetting something. I think that's it. I think I have a video for that for polishing with the rag wheel. We can see that maybe in a little bit later. Okay. Any questions about what we talked about so far? A lot of easy information, I guess. Not too many things in there, but know the specific things that we talked about. It's finishing the first one and polishing the second one. Okay. Our next slides will be talking about dental waxes. And again, this is part of chapter 16 that we already talked about with gypsum products. So we're just going to know the different types of waxes that we use in dentistry. And then what are their uses? Most often these waxes are used in the lab, because we use them to actually create the filling material that we have sometimes. So they make it, especially with partial dentures and complete dentures, they make the dentures with waxes first, and then they burn out the wax and they put the metal instead of it. And that's the lost wax technique that we'll talk about at the end of the slides, and we'll see a video for. But again, most of the wax we don't use in office, for example. The only two that most probably we use are utility wax and maybe bite registration wax. But again, most of these are used in the lab, but still used in dentistry, so we get to know them. Okay, so we have some definitions here. Blank is the range of temperature at which each component of the wax will start soften and then flow. The melting range. Blank is the movement of wax as molecules slip over each other. That's the flow. Excess residue is the wax film that remains on objects. And dimensional change is the expand when the heat and contract when called. Just few definitions here about wax. We got that? Okay. So now we'll talk about the classification of waxes, and then we're going to talk about each one of them. So technically we have three classifications. We have pattern wax, we have processing wax, and then we have impression wax. Impression wax is not used anymore, right? We don't use them. We don't use wax to take impressions anymore. We use alginate, we use polyvinyl siloxane, and all of that. Pattern wax is usually used for making the fillings, to make the filling. So it has an inlay, casting, and base plate types. And then processing wax is used to help us in creating the filling itself. So the pattern wax is usually the filling itself, what we make, how to make the filling with wax first, and then uh, pour it with different types of metals. And again, the processing is used to help us do that. And you'll see that. These, a lot of times, are used in office, but again, not really as much. And these more in the lab. Okay, moving on. So just three types of waxes: pattern, processing, and impression waxes. And we know that each type of them is different than the other. Okay. Moving on. So now we're going to talk about each one of these. So we have, again, pattern wax that we said it has three types in it. It has inlay and casting and base plate. So used to fabricate restorations, as I said, that is the pattern wax. And it must have a flow, And then we have the first type of the pattern wax, which is the inlay wax. And this is used to create crowns, inlays, or bridges. So again, kind of just guys know the main use of each type of wax and the shape of it a little bit as well. Well, not these. I'm not going to get you these and get you to know them, but there are specific ones that you can really recognize in a minute. But yeah, these are the inlay waxes. They come in different types. And again, these are used in office. It will make more sense when we see the video, but technically, we create the filling with a wax first, as I said, and then we replace that wax in a process that called lost wax technique to make an actual filling. Anyway, the casting wax, which is part of the pattern wax, right? This is to use to do the framework for removable partial dentures. The framework is what you see here. That is called the framework of the partial denture. So it's not the teeth, it's where the teeth would sit on. So usually, as you can see, they come in ready-made shapes that we can cut and use right away to make these things here. And we have one more type of wax that is part of the pattern wax, right? And that is the base plate. And base plates are these that you see here. So these are used on custom trays. So this is, well, not custom trays, it should be, well, partial dentures. Because, I mean, technically, it's not custom. I think it's wrong to say custom trays because custom trays are the ones that we take impressions with. It is, well, I will find a better word for that. I mean, technically, you use it. Yes, don't worry about custom trays. You use it to establish the vertical dimension. So this is when we have an edentulous patient most of the time, and you want to restore their teeth. Edentulous patient, the patient that doesn't have any teeth, right? So if, for example, they don't have any teeth on the maxillary and on the mandibular teeth, and then you want to make sure that you're restoring the actual vertical height of their mouth, because usually those patients will lose their vertical height. Our face profile also is linked to our teeth because our teeth will give us a little bit more height to our faces, right? So if we want to restore that vertical height of the teeth, we'll use these plates. So if you see here, this is how the process go. So first we place them like that, and we place them inside of the patient mouth, right? And we can wipe them off a little bit by a little bit to make sure that we are creating enough height for each arch. And then we start putting the teeth on the wax, and then we can try them. I don't want to go too deep in this because we're going to talk about this later on about partial dentures and complete dentures. But know that the base plate waxes are used for these kind of work, so partial or complete dentures, and they can work to restore the vertical height, so we can place the teeth in the correct height inside of the patient mouth. And this is the way that they look. Well, everything is gone. This is the way that they look. So, if I get you a picture of that, this is a base plate wax, right? Excuse me. Again, a little bit more pictures. You can see these are the casts of the patient, and we have the wax on again, and this is restoring the vertical height for the patient and making sure that we can have the teeth in the correct spaces for the patient, so they would again restore that vertical height. Now we're done with pattern wax, right? We talked about pattern wax, and it has three types in it: the inlay, the casting, and the base plate. We said the inlay is for crowns and bridges, right? We know the casting is for what? The framework of complete or partial dentures, and then, or the partial dentures for specific. And then base plates are for vertical height restoration, especially for complete dentures, right? Now we're going to talk about processing wax. So processing wax, again, as I said, it will help in making of the impressions or the casts. So for example, boxing wax is used in pouring impressions. So if you see this picture, you can see that we have an impression here, and we put a wax around it, and this is the boxing wax actually. The wax that we use to make a box around the impression. So when we pour the impression, the plaster would not fall all around. So we can make a bigger, base or art portion of the impression when we pour it. Easy, right? Then we have utility wax, which we're going to use when we're doing impression on each other. Some people will use it on the impression trays, as you see here. They would line it up, the borders of the impression tray. It makes it a little bit more comfortable for the patient because these edges of the trays are a little bit sharp. Sometimes it makes it a little bit more comfortable. And also, it will create a little bit better peripheral roll to get the vestibules. So again, not a lot of people do it, but some people prefer to do it because you'll get better impressions with it. And that's what a utility wax is used for. It can be red or white. And again, we're going to use it later on. So again, if I give you a picture of this and I ask you what wax type is that in there, you know that this is utility wax, and it's used to help take in impressions, right? This is boxing wax. Again, you can recognize these pictures. And then you have the sticky one. And from the name, it's used to reassemble pieces temporarily in position. So it can be, definitely hard at room temperature and sticky when it's melted. And a lot of times these are used in the lab, not in the office. Well, sometimes maybe if you need to. But again, most probably the only thing that you'll see a wax used in the office, most probably the utility wax. Maybe people use boxing to pour, but I don't think so much. And then the bite registration wax. Some people will use it to make bite registrations. Remember the bite registration we saw with the PVS that you put on the teeth? Sometimes they use wax for that. So, and impression wax, as I said, not used anymore. It used to be used for edentulous impressions. Any questions? Concerns? Easy, right? Again, just make sure you know your classification and what each wax falls into and what it's used for, how it looks like. Not a lot of things, again, just these classifications that we have, and each one have the different parts in it. The last slide, we need to see a video most probably about it. Okay? And we'll go back to this. So let's switch gears. Let's go watch a video. Lost wax technique. Okay. So let's see. Well, this is an arch, right? You can see. And what are we trying to make here? What is this for? Partial denture, right? You see that the patient has only anterior teeth technically. Well, they have some premolars here, but they're missing a lot of teeth on one side, all of them. And on the other side, they're missing some of the teeth. So we're making a partial denture for them, okay? And what is this thing that they are put here? What is that material? This is wax, right? This is wax, actually. So, and again, what type of wax is this one? Casting wax, right? Because it makes the framework, which we said, this is the framework of a partial denture, right? So far we know at least how we started with to make a partial denture, for example, how waxes are used to do that. So we make the shape of the partial denture and all of the connections. These things are called rests. See how they rest on the teeth, so they would actually provide some stability, and they have some clasps on the side, and again this will prevent the denture from rocking side to side. Anyway, this is all created in wax, right? As you can see. Now what they're doing, they're attaching what we call a sprue to it, and you'll see why. So we are making some kind of a tube to the material so that when this burned out all the way, we'll have a space remaining to pour the metal inside of it. So just think about that. We are going to make this. We're going to pour this with plaster, okay? So it'll be all covered with plaster. We put it in an oven that is so hot that it will evaporate all of the wax in there, okay? So what will remain? An empty space of the wax where the wax was before. Does that make sense? Right? So we put that, put it in the oven, it will burn out all the wax, and then it will just remain an empty space. Within that empty space, we'll pour a molten metal, and that metal will create the partial denture. We'll see in the video. Hopefully this will click a little bit more. So this thing that they just placed is called sprue, and again, you'll see why they did it in a minute. And they put like a, what do you call that part? You know, just an opening for you so you can pour the cement, the metal in. Right? So again, imagine that these are empty or hollow, and you pour molten metal in there. So all of the metal will go in and fill all these spaces and make the partial denture technically. They're just sealing it up and all of that. And now you'll see they pour some plaster into it. They're using this mixing machine that mixes the plaster or the stone well, any type of gypsum products, because it has evacuation in it. Putting a separator. And now they're pouring that again, all of that in there. And the only part that will remain is this part on top. This will set, and once it sets, we will put it in an oven. See, this is done. And then we put it in an oven that will evaporate all of the wax that was in there. Now they're going to put in a device that will shoot the molten metal into that part that we just created. So they heat the metal, they put that in there. This is the part that we just put in the oven that we had the wax inside of it. And it will centrifuge, it will run really fast. And you'll see now it's done. And see, this is the metal the molten metal, shoot it inside of that part that we just created. They will break it down. Sand it, I think, is that sanding? And now you see, this is metal, right? This is the thing that we just created in wax, and now it's in metal. Definitely, they're going to finish it, cut it, and polish it, and do all different things with it. And then they can add the teeth to it and make a partial denture. Did that make sense? Kind of. Huh? A lot of work, right? Yeah, in a way. But again, generally, that's, I mean, I can explain all day here, but I think a video would explain better. Hopefully, you guys got the idea. Let me see. I think I'll share my screen here just for one more last time to finish that part that we just talked about. Okay, so this is the lost wax technique or pattern, right? So we definitely take an impression, and you make a cast with the stone. You put the wax pattern like we saw, right? You put a sprue. That is these are the 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 waxes that she put on to connect, and then the big thing on the top. That's the sprue. You put in an investment. An investment is that's the gypsum that she poured in into that material. You heat it in a burnout, right? And you will make the wax evaporate. And then the molten metal is forced through that channel that is empty, and then you can take it out. So you make an impression, right? And then you put the wax pattern, you make a sprue, and then you put an investment on it, which is gypsum technically. You put in a burn out, and then you put the metal through it. Doesn't make any sense, right? All just red circles. Anyway, hopefully the video helps. And again, it's just a process of making wax, heating up to evaporate, and then putting metal into it in place of it. Okay?
So Lehman, we're gonna do this like the video.
Oh, no. No, definitely not. This is a lab work. Okay. So, any questions, guys? I don't think so.